Hello, Health First Colorado providers. Our previous video provided a broad overview of the EPSDT benefit that's included in Children's Health First Colorado coverage. In this video, we're diving into the technical details that support your responsibility to help a child access all the health services and care available through the EPSDT benefit. Let's make sure every child gets the comprehensive care they deserve. As a reminder, EPSDT stands for Early and Periodic Screening, Diagnostic, and Treatment. It's a crucial Medicaid benefit designed to ensure children below age 21 receive proactive and preventative healthcare services, as well as support for health needs that go beyond what is typically covered by Health First Colorado, all at no cost to the family. EPSDT is not private insurance, so you can request anything that you believe corrects and ameliorates a child's health condition. EPSDT does not have an exclusion list. EPSDT covers a range of services that ensure general child well-being. These include age-appropriate screenings to identify any potential health issues or developmental concerns, such as comprehensive health and developmental history that assesses for both physical and mental health, as well as for substance use disorders, comprehensive unclothed physical examination, appropriate immunizations in accordance with the schedule for pediatric vaccines, laboratory testing, and health education and anticipatory guidance for both the child and caregiver, as well as diagnostic and treatment services. These include diagnostic tests, specialized therapies, chronic health condition management, and specialized medical equipment and supplies. Before EPSDT covered health services can be provided to the child, you'll need to check the child's eligibility in the provider portal. EPSDT covers all children under 21 enrolled in Health First Colorado. If the child is eligible, we're on the right track. However, if the child is not enrolled, you will first need to direct their guardian to apply for Health First Colorado coverage. Children with more acute medical needs can also apply for Health First Colorado coverage, even if they have private insurance. More information about qualifications and enrollment can be found at hcpf.colorado.gov. Before we explain the process for accessing EPSDT benefits, let's get familiar with some important terms. Understanding these terms will make navigating the process a lot easier. Because EPSDT covers such a broad range of health services, sometimes these services are provided within the Medicaid network, or what is called a managed care entity. And sometimes the services must be provided outside of it, what we call fee-for-service providers. The managed care entities for mental health and all care coordination are known as RAEs. The RAEs' responsibilities include ensuring Health First Colorado members, including children, have access to primary care and behavioral health services and coordinating members' care. You will have to work closely with the child or youth's RAE and the child's parent, guardian, or child welfare professional throughout the process of accessing necessary health services for the child. The last term that's important to know is medical necessity. When pre-approval is required for the services, you may need to provide documentation that demonstrates the medical need to one of Health First Colorado's utilization management companies, or what we call UMs. They must review and authorize the request before you can provide the health services. Here, it's helpful to think about your own experience working with patients' private insurance providers. Sometimes you can provide services immediately without needing to get approval from the insurance provider. Other times, you need to get pre-authorization from the insurance provider before delivering care, including providing documentation that proves the service is medically necessary for the patient's health. The process is similar for Kids Health First Colorado coverage, with one major difference. Unlike private insurance companies, Medicaid has no exclusions list because of EPSDT. If you think it's medically necessary, you should ask for it. Here's how. If a child needs services at the emergency department or an urgent care facility, these are covered as long as the facility is enrolled with Health First Colorado. If pre-authorization is required for other requested health services, you may have to prove a medical necessity by providing documentation to the before the care is authorized. This process may take several days, but it will be done. Providers should check the company's system for the status of the request. Now, denials will happen. Typical reasons for this can include a lack of documentation that demonstrates the medical necessity. It's an experimental or unproven treatment. Now let's talk about early and periodic screening services provided by EPSDT. EPSDT also covers mandatory early periodic screening health services that must be provided to kids with Health First Colorado coverage in your care at no cost to the family. Routine preventative services like physical exams, vision screenings, hearing tests, dental screenings, immunizations, developmental assessments, and more are covered by EPSDT as often as needed if medically necessary. No pre-approval is required to access these services. So what did we learn? If a child in your care needs health services to prevent or treat a health condition and you believe it's a medical necessity, ask for it. Even if you don't think it's covered, it's likely EPSDT will take care of it. With this knowledge, now you can get kids under your care what they need using Health First Colorado's EPSDT benefit. We have more resources for providers at hcpf.colorado.gov or contact the company, the Child or Youth SRAE, or reach out to HICPUF directly via email with additional questions.